So to the specialty pharmacy, are you just licensed by the State Board of Pharmacy, or are you licensed by the Department of Health Services as well?
We're licensed by the State Board of Pharmacy.
Okay. And are there any special requirements on you as far as being a specialty pharmacy and selling, if you will, clotting factors?
Not in respect to the Board of Pharmacy, but DHCS does have guidelines that we are required to meet and follow and standards.
So it's my understanding that you have to carry an adequate inventory of all those clotting factors, and that you're at risk. If you have those clotting factors in your stock and they have expiration dates, if they expire, that could be a significant loss to you. And obviously, being able to have the appropriate reimbursement will allow you to remain in business, because with the expense of these clotting factors, if you have to dispose of 25% of them because you didn't have a chance to dispense them, there's got to be some way to reimburse you for that. So, and I kind of heard that there's a federal intervention here, which is getting in the way of continually reimbursing them in such a way that they can continue to stock these life essential factors. And it's my understanding that even emergency rooms don't even carry these factors, or most of them, and unless you tell me otherwise, but it's my understanding that they don't.
Right, so these are some of the most expensive products that the program reimburses for, and you are correct, it was a federal rule that essentially, I think there was concern at the federal level that the way that the reimbursement was being done was that they were trying to decrease the margin. So we are essentially paying for the acquisition cost. So if it costs a pharmacy $50,000 to acquire a blood factor product, we pay the acquisition cost of $50,000, and then there's a dispensing fee. And I think what had been traditionally paid was a differential rate. And so a lot of the ancillary support and a lot of the other kinds of conditions around how these pharmacies provided care management and coordination services and the whole thing was encapsulated in that previous rate. And so we're having to break apart all of those different components. And then the federal government wants to understand how we would propose to pay for those separately so they can have a better visibility into the overall cost of those services. Yeah. So that's the process that we're in development with right now.
Well, I can understand if these were traditional pharmacy products, like, Sovaldi, very expensive, you buy capsules, with computer technology, insurance companies, governments know pretty much what pharmacies pay for things, and then they give a pretty low dispensing fee. This is a case where they have to carry a variety of multiple factors. I think there's 20. I'm going back to pharmacy school now. I think there's 20 clotting factors out there. I don't know how many need to be kept in stock readily, but it's my understanding that these pharmacies need to be available 24 hours a day, 7 days a week, which is an inordinate expense. And it's just not so simple as just figuring out your acquisition costs, just adding a modest fee, because I think many of these specialty pharmacies will not be in business for this very narrow pathology of hemophiliacs that we need to ensure that they have appropriate access to the clotting factors that they need. So it's my hope that we continue discussions, that you continue discussions. And I don't know, have you been meeting with the specialty pharmacies?
Oh, yes.
Okay,
yes.
Great.
There have been lots of work groups, and we've met with both the broad community of pharmacies and stakeholders, as well as we've had individual meetings with particular specialty pharmacies. I've met with some. My pharmacy division chief has met with a lot of others. And then we've been asking for them to provide us data in terms of show us your costs, show us your reimbursement issues, show us your ancillary support, show us all these things so that we can better understand what the true nature of the costs are, because we are just as interested in maintaining access for these services, understanding that they are very rare, very important, very critical services.
Well, I appreciate that. I'm happy to hear that those meetings will continue. I would even like to be invited, if I could, if you get to a point where we're reaching a conclusion. I want to make sure that we're not going to be putting some of these specialty pharmacies out of business, mostly due to the disastrous effect it's going to have on these patients that are going to find their way to our emergency rooms and not get the relief that they need. And if you look at the number of bleeds that have happened with the present availability of these specialty pharmacies versus in the past, when we didn't have these specialty pharmacies, the number of bleeds was quite extravagant. We don't want to return back. We don't want to go backwards. We want to move forward, but we need to make sure that these specialty pharmacies are given the appropriate tools to stay in business, and reimbursement is probably top on that list. So I'd like to be a part of that discussion.
We'd be happy to.
And if we need help with the federal government, I'd like to help in that endeavor too, because I think they're taking a very short-sighted review of what's entailed in dispensing and ensuring that these clotting factors are in fact readily available and expeditiously delivered when the patients need them. Appreciate your help with that.